Welcome back to Roaming with Restless Women. Today I have Janelle Miller Moravek. I should have asked you if that was the right way to say your name.
It's close enough.
Okay.
Yes.
Janelle is a nonprofit leader and mental health advocate who helps families navigate a system that can often feel overwhelming. As executive director of youth and family counseling since 2009, she has led its growth while expanding access to care across Lake County, Illinois. Known for her practical and compassionate approach, Janelle speaks out on how to find the right mental health support, strengthen communities around youth, and build more sustainable systems of care. She's especially passionate about mental health literacy, supporting caregivers, and addressing burnout in the behavioral health field. She also brings a leadership lens to her work, sharing insights on workforce performance and development and building resilient, people-centered organizations. Janelle serves on the board of the Lake County Alliance for Human Services and co-chairs the Lake County Behavioral Health Action Team. Welcome, Janelle.
Thanks, Julie. It's good to be here.
So tell me how I have mentioned to you before we got on air that
hmm
I very much appreciate the hardship that it is to work in nonprofit. So tell me how you started in nonprofit and why it has been your whole life.
Yeah, it's a bit of a story. I'm an
Mhm.
accidental nonprofit worker. So I'm going to actually go all the way back to
Okay.
when I was in high school.
Oh,
And
cool.
yeah, my dad was the librarian at Lake Forest College, which is local here in Lake County, Illinois. And my mom was a high school teacher. And as I was looking at colleges, my parents said to me, listen, you have two choices. There are two paths for you to take. You can go to the school of your choice, anywhere your heart would desire, but know that it will be the no frills option. You won't come home. You won't have a car. Like, you won't have a TV. This was in the late 80s. So, right, it was a whole
Hmm.
thing. They're like, or maybe present you with this other option. You could go to Lake Forest College tuition free and you could have a car and a television. And I said, are you kidding?
Yeah.
I want to get as far away as I possibly can. And so I chose a school in Connecticut and took the frills option. I found a friend to go home with every Thanksgiving and, only came home at Christmas and summer. But then for my junior year, my dad said, would you just do me this nice favor? And would you do your junior year at Lake Forest College as your year abroad? And I said, let's make a deal. I'll do that if half of that year can be in Paris and the other half can be on the home campus. And he's like, done. And
Oh,
so that's what I
wow.
did. But when I got back to the home campus, because I was tuition free, I was assigned a work study job. And my work study job put me in the development office at Lake Forest College. And
Wow.
I was introduced to this amazing team of people who I adored and who I still keep in touch with some of them. Um, and and then when I went back to my school in Connecticut for my senior year, I walked into the development office there and said, do you need any student workers? Because I'd love to work for you. And I happened to run into and be talking to the director of the major gifts officer. And he was like, oh, thank God, because I just hired Anne over here for planned giving. And we're carrying boxes into her office of all of the trusts. And if you could help her sort through those and go through them, that would be amazing. And just like that, I started working in the planned giving department. And
Wow.
that was amazing. The woman I worked for was amazing. And she said, this is like Vegas. Ask me any questions you want. We can talk about anything, but it stays here because you're talking about people's finances, their lives right there. And because I was reading through all of these planned giving documents, right? Trying to
Yeah.
figure out what was restricted, what went where, who was whom, also that she could jump in and establish those relationships. So then I graduated, and she had sent me to a conference, and I had found an internship there. So then I rolled into that internship. And then after that, as I was wrapping that up, she called me back and she said, listen, our president just announced he's retiring, and we need someone who can organize a series of alumni conversations around the country. And she said, honestly, we need someone who knows the players, who knows the database. Can you come and do this? But it's only for like a year. And I'm like, sure, why not? So I went and did that. Uh-huh. And then I wasn't ready to leave the university setting. And so then I stayed on and did some corporate and foundation relations, and it just then kept evolving. Like I kept getting these jobs in fundraising and development, and I discovered that I was pretty good at it. And so, kept going along the way, got married, moved back here, and at a certain point said, I think we want to start a family, and didn't want to be working a big development job. At the time, I was director of development for a Catholic high school, and it was a big job. And I didn't really see how I was going to do motherhood and working 50, 60 hours a week.
Yeah.
My husband, we talked, and he said, listen, if you want to go part-time, why don't you go part-time? And so I found this great little organization called Youth and Family Counseling, and they were looking for a development director. They'd never had one before. They couldn't afford one full-time. I made him a deal. I'm like, I'll do 20 hours.
There you go.
And I did that. I started in 2000. So I basically built the development program. And in 2009, the executive director left. And I was getting increasingly frustrated with lack of long-term plans, lack of strategic growth. And so when he announced that he was leaving, I went to the board chair and I said, I would love the opportunity to step into his role, because here's what I would do. And I laid out my plan. And she's like, that sounds great. Go for it.
Yeah.
And so I did that. And I've learned everything that I need to know on the job. And
That's
it's been
wonderful.
An amazing adventure. And I'm still learning on the job every day.
So what is your actual degree in?
Yeah, I have a bachelor's in French cultural studies and international relations.
Wow. Well, there you go. It just goes to show that
right,
no matter what you study, bits and pieces of it are ultimately relevant for where you land.
Yes. Well, I was honestly going to, after I graduated college, I was going to go to grad school in Paris, and I was going to meet a Frenchman and never come back.
Yeah.
That didn't happen because I happened to fall in love with this guy who was a high school teacher, football coach, and those don't really translate.
Yeah.
And so I said, you only get one true love, and so I'll just find something else to do. And I figured it out along the way.
Well, tell me about what you are doing right now.
Yeah, so right now I'm actually really excited about what we're doing right now. So at YFC, our mission has always been to make mental health counseling affordable for folks who might not otherwise be able to afford it. My organization has been around since 1962. Obviously, the world has changed a lot since then.
Yeah.
What I have loved doing here at YFC since 2009 is expanding that mission. So it's not just about affordability, it's also about other parts of access. So linguistic and cultural access. And
Yeah.
up here in Lake County, transportation is a big issue. So it's making care local so that families can make it work every week, because it's not like a medical appointment where you go once. It's not a one and done. This is a longer term commitment.
Yes.
And then that has even evolved to, listen, the barriers that get in people's way when they're seeking help, they're like bamboo. They're always cropping up. It's always something new. What
Yes.
I'm excited about is we've been able to look a little bit farther upstream and say, okay, what are the systemic
Mhm.
issues that are preventing sort of that long-term problem solving? And
Yeah.
we're really doing a lot with workforce development in Illinois. I'm sure this is true throughout the county, but in Illinois, I know that our behavioral health workforce is only able to meet 24% of the need. And so
Wow.
when you talk about the mental health crisis that we're in, and then you realize how small the workforce is, it's only exacerbating the problem. And so there's a lot of cool things happening to allow other pathways to care, but we also have to increase, strengthen, diversify the workforce. And so YFC is very excited about the things we're doing to do that. We have a high school program to introduce high school students to the possible career options in behavioral health care. High school students love mental health. They talk about it.
Oh,
They're
yeah.
right. They're not terribly worried about the stigma, and they're
For them, the
super
stigma
curious.
really, that's one of the wonderful things I think that came out. It really, it got highlighted during COVID
Yeah.
that the generational divide, and I guess squished. It
Mhm.
got smaller because the younger generation felt more free to say what they really believe, and their
Yes.
values started to be what was driving the rest of the culture, as opposed to the boomers and the older Xers, um, where the stigma was very real. I mean, when I was diagnosed with clinical depression, I had it on both sides of my family, but nobody had ever been diagnosed.
Yep.
So it was one of those, what's wrong with her? Just suck it up, deal with it, you know.
Hmm.
Why are you always so sad or negative or whatever? And thank goodness I finally found someone who could actually do a diagnosis. But yeah, it was almost like I came out to my family.
Yeah.
And then I find out that several of my cousins were on the same journey as me. So I think it's wonderful that the younger generation has basically almost eliminated that stigma.
Yes. I mean, in so many ways, they're changing the world, right?
Yeah.
So, yeah. And my hope is that we can channel their excitement and their passion for wellness into a stronger workforce, right? I mean,
Mhm.
theoretically, everybody should be upskilled in recognizing, responding to emotional distress. I mean, if think about
Yes.
it, if we were all able to do that effectively, then we wouldn't have problems that waited until they were crises, because we'd
Hmm.
be on it. Um, I don't know why it is that we reserve, identification and response to school social workers, doctors, right? Nurses. Um, that's not the people who are going to notice. It's going to be the teachers who deal with the kids every day, the
Oh,
coaches.
yeah.
It's going to be
Yeah.
the faith leaders, and it's going to be you and me who know people
Hmm.
and know when something is not right, or when they're off. And
Mm-hmm.
we have to empower ourselves to check in. And I think sometimes we don't do that because we don't know what to do when somebody says, I'm not okay. We're like, ooh, ah, you know?
Yeah, yeah. Well, and it's almost like when there's a death and you don't know what
Mhm.
to say.
Yeah.
It's almost that same exact feeling of what can I do? What can I say to not make it worse?
Yes.
You know,
Yes.
for that person, because people generally they care about other
Mm-hmm.
people. It's not like they're trying to be, um, you know, non-empathetic. It's that they don't know how to be empathetic.
But and we don't know how to talk about it. Like we
Right.
don't even know how to say, for example, I was at an event with and there was a mom who I knew just from school events, and I knew
Hmm.
she had an older son, and I was like, "And how's your son?" And she was like, mm, and I could see this going on, and then she said, "He's not well. We had to pick him up last week." And I was like, "Oh," I'm like, I run a counseling center. Is there anything I can do to help? And then she literally sat down and started just talking.
Oh,
And I did a lot of listening and affirming, and you're doing the right things. And, you know, if you need something else, here's my number. She never called, but people, we just don't have the words. We're not used to having these conversations. And I think that's getting
yeah. Yeah. Well,
worse
and
and
what you
worse.
just said is key. You didn't talk, you listened and you
Mhm,
affirmed. And
mhm.
sometimes that's all people need, just to know that they're not
Absolutely.
alone and that they have someone they can unburden on
Well,
who understands.
and people don't know. Here at YFC, we do things maybe a little bit differently. So every time someone calls in and wants services, our scheduler Betsy, she says, "Yes, let's get you on the calendar for." We always do an assessment right away. And this, when she said yes to this parent was like, "Oh, every other place I've called, I've gotten put on a waiting list." And she's like, "Well,
Oh,
let's just come on in and let's figure this out." And so she got them in the next day at 9 a.m. and the very high anxiety and about some behaviors. And after they talked it through and did the full assessment with our intake worker, um, who was affirming, was like, okay, well, I can see, and that's, to me, that's a level here that's not up
yeah.
here. And let's give you, let's talk about what you can do with this. We can give you some skills right now, and we can set you up for services if you would like them. And they're like, oh, yeah, that would be great. And then they left and they were whew, so much like just
Yeah.
right.
Yeah.
But when you don't know, and then it builds and builds and builds until you can get an answer.
Well, and it builds and builds until you either explode or you implode.
Mhm.
You
Yes,
know, and neither
yes,
one of those is good.
yes. In some ways, yes. But I also don't like that our system is set up
Yeah,
to wait for people to get
right.
to crisis level. It shouldn't be that way. It's Listen, more people are impacted by mental health than they are by diabetes and heart disease combined.
Oh,
Yet
yeah.
we do all this prevention work around diabetes and cardiac issues. We do screenings, public information campaigns, right? We're on it, not with mental health.
Well, let me ask you kind of a loaded question. How is business right now? Have you found that given the chaotic environment, the wars, the basically the chaos that we're living in, economically, politically, whatever you want to call it, have you seen an uptick in, because I've heard so many anecdotal stories of people, I just can't watch the news. I'm so upset about what's going on in our world. I can't feed my family, I can't pay for my gas, whatever it is. Have you seen an uptick over the last, 2 or 3 years?
Yes and no.
Okay.
When I, right, because I've been here for a long time, so I have
Yeah.
this wonderful historical data. I would say that we started seeing a real spike, especially in young people, around 2018. And
Okay.
in when COVID hit in 2020,
Yeah.
it was interesting because we watched the the need for services in adolescence actually decrease at the
Wow.
beginning. Well, there weren't as many stressors on them, right? They didn't have to do the national service hours, and they didn't have to do the sports and the homework, and the
Got
workload
it.
was less. But
Okay.
then as COVID persisted, it has definitely, the demand on all fronts has increased. Today at Youth and Family, our fastest growing client group is 6 to 11 year olds.
Oh
Um,
my goodness.
yeah. Um, Conflict, dealing with conflict, transition, separation, socialization, behaviors. That's our, I would say right now that's about 35% of the 900 or so clients that we have. Another 30% are adolescents,
Yeah.
young adults who also are very much on the struggle bus. Um, in general, and our population is primarily low income, right? So our mission is
Oh,
to make
yeah.
sure that the folks who are often left behind, they have a place, and that place is YFC. So Medicaid, um, sliding fee scale, and even insured who are low income. It's the ALICE, the asset limited income constrained individuals, right? They have jobs, they have insurance coverage, they still
It's
aren't
not
making enough
enough.
to survive.
Yeah.
Um,
Right.
and what we found is actually this year in 2026, the number of service requests each month is lower than what we've seen in previous years. And I think that's because everyone is in crisis and
Yeah.
hierarchy of needs. So it's really hard to prioritize mental health when you are dealing with food, shelter, right? Transportation. Um,
Yeah.
Quite honestly, we just come second, which is, I think that's just the way it is. It doesn't mean that people are well. I think they're getting worse, right? I think the level of severity of distress and symptoms is worsening, but also at the same time, in so many ways, where there are doors closing because they can't afford
Yeah.
gas to get to their appointment, and there's very limited public transportation. They're spending their time trying to source food by going to food banks or wherever, and that, if you're working and then you have to do that, like, it's a full-time job being
Oh,
poor.
yeah. It
So
is. It is.
really
And
hard for
it's
them to,
high, high, high stress.
it's very high stress. So I
Mm.
think that what we're seeing isn't necessarily less, it's that, how are we going to do different to
Mm.
make the services accessible in this new landscape? And I don't have that figured out yet.
Yeah.
But I think that's it's just it's a different question.
Well, thank goodness for people like you who are thinking about it.
Thanks. I mean,
Yeah.
it, listen, in this country, we have wonderful nonprofits who do great jobs of solving problems and being that safety net and bridge helping families bridge that gap between survival and thriving. But our work is getting harder every day. We are getting these organizations ourselves are incredibly strained. The infrastructure we exist in is being dismantled. So think
Yes.
about, the Medicaid cuts. That is how so many people access care.
Oh,
We're taking
yeah.
that away from millions. But also there are attacks on the federal grants that also fund. So the states that fund, and individuals, when you're playing with tax codes, right? You're playing with individual supporters. So in so many ways, need is rising, resources are going down,
Yeah.
right?
Trying to
We're not headed,
optimize.
yeah, we're not headed in the right direction.
No, I
At this
agree.
at the same time, there's incredible opportunity with the advances in technology and digital
Yeah.
care, the awareness and recognition of the
Yes.
importance of mental health, and also those social drivers of health. Those are, I think everyone is becoming a little bit more aware of the role that education, environment, um,
Early
all of those
intervention. Yeah.
all those things have on our overall well-being. So there's a lot of
Yeah.
hope, and there's also a lot of potholes.
Yeah. A lot of challenges, but you're the
Yeah.
kind of person that it sounds like your whole life, you have been able to figure out ways. And that's what it takes when you're in nonprofit. It's what it takes when you're an entrepreneur. It's
Yeah.
what it takes in this crazy world, in this crazy thing we call life, you know.
Right. Yes.
And the fact that, excuse me, the fact that you can strategize and you can figure things out is a beautiful gift, especially since you are giving that for others. And that's a big testament to the nonprofit world, you know.
Yes. Well, I don't do it alone. No executive director
Well,
does it
of
alone.
course. Yeah,
But
of course.
I think that, and we just kicked off a board recruitment campaign. We're looking to expand our board, and we've been thinking about what is it that we're looking for? What makes a really successful board member at YFC? And we've landed on curiosity. And that's
Yeah.
something that I lean into all the time, right? I'm curious about, how are things going? How did that end up? What got in the way? What's out there? What don't I know? And when board members, so that goes two ways, right? I need a board that can supplement my knowledge so that I can be curious about what they know and what they're seeing. But also they need to be curious about YFC and our world. And when that works well, it's really cool, right?
Oh,
That,
yeah.
because then that's that group high level problem solving that is impactful and super engaging. So
Absolutely. Well, I
curiosity.
want to know, I want you to tell everyone how they can get a hold of you and how they can learn more about YFC.
I'm going to say two things.
Okay.
So, number one, our organizational website, which is counselingforall.org.
Mm-hmm.
And the second one is follow me on LinkedIn. I talk about all of these
Yeah.
things on LinkedIn and try to make it a try to use my space to also inform and provide knowledge that people, not just in Illinois, but everywhere, can use to achieve wellness. So,
Oh,
yeah,
I will definitely get that into the show notes for this
thank
episode. So,
you.
folks, make sure
Thank
you
you.
take a look at that. All right, I have three questions that I ask everyone at the end of every episode. My
Okay.
first question requires you to close your eyes just for a moment.
Okay.
All right. So, describe to me what you see in your mind's eye when I say wise woman.
Ooh, I see a pen and ink. I'm not a visual person, but I do see a pen and ink drawing
Uh-huh.
almost a Native American, but maybe with a little bit of a fantasy bend on it.
Uh-huh.
I'm a
Perfect.
huge fantasy reader, so
Yeah, me too. Me too. What's she doing?
what's she doing? Um, she's just radiating.
Oh, I love that.
She's not
Yeah.
really doing anything. She's just radiating.
It's her presence that is beautiful and wonderful. Absolutely. Well, thank you. You can open your eyes. For my
Thanks.
next, I know it's really awkward, isn't it? I love doing that to people.
I was honestly thinking, I hope my makeup it looks good.
Oh, it does. It does. My next question. Where do you
Hmm.
like to roam, Janelle?
Oh, well, the old Janelle, pre Janelle 5.0, which is Janelle 50, would have said Europe. I love all places, European destinations. The reality of Janelle post 5.0 is that I pay a lot of college tuition,
Yeah.
launching some young adults. So I'll pretty much take anywhere roaming. Doesn't have to be far, but
Right.
my husband and I are leading into micro trips.
Yes.
So,
Yes.
in fact, in a couple of weeks, we are going literally just over the border to a little town, but it's on the lake, on Lake Michigan. So it's
Oh,
in Wisconsin on the lake. I think it's only going to be 2 hours away, but we are going to have a micro vacation.
oh, beautiful. Those
Yeah.
are refreshing.
Yes.
Just
So I think
changing
I'm
your viewpoint or changing your
right.
outward place. Oh yeah, it makes a huge
I
difference.
We haven't been able to have a big trip in a few years, and so we've been trying to figure out how do you get that respite that you need in these sort of little bursts.
Yes,
And
absolutely.
we're tweaking.
Yeah. My last question for you is what makes you restless in a good way?
Oh, oh, too many ideas. Um,
You sound like me.
for real.
Yeah.
When I go or I have a new topic or I learn something, then my brain just like is on fire trying to has questions and make connections and so yeah, yesterday I attended a really lovely gun violence prevention event where my deputy executive director was doing a mini TED talk. And I got to hear seven other little talks and met so many new people and connected with other people that I hadn't seen in a while. And so now today, my brain is like, I've got to follow up with this person and I want to learn more
Oh,
about this. I have all these notes, right, that I
yeah.
make. So that's what gets me restless. And there's just not enough hours in the day.
Yeah,
So
absolutely. That's what happens to me when I go to a conference. It's almost like I have to take a day off after the conference just to decompress from all the ideas. And then I start prioritizing and looking at what can I actually act on or learn more about or yeah, it takes a minute.
how do you get them out of your brain? I'm always curious
Hmm.
as to how do you get them out of your brain so that you can process them and prioritize them?
Whiteboard.
Whiteboard.
Yep, I have a whiteboard in my office and that's what it's for. Because otherwise I get stuck and I'm not able to act on anything,
Mm-hmm.
right? I have to get them
Yep.
out of my head and somewhere safe So I don't lose them.
Yep.
But I would say probably 80% of the ideas that I have coming out of a conference or during a conference, I never do anything with because it goes through a winnowing process. Sounds good in the moment. And
Hmm.
then when it gets on the board, and then when it gets prioritized, then some things have to fall off. So, but it's just a process. That's just me though. That's Julie 6.0.
Got it. What? But you know, this is how I love learning. Is what do you do? What works for you? I might
Absolutely.
take some in my head. I'm going. Oh, I wonder what a whiteboard would look like in my office. You know.
Yeah. Oh yeah, I've had one my whole career. I've never had an office or a cube even without a whiteboard. So it's integral to how I process. I know, I'm old
Awesome.
school. Write it down.
That is coming back. It's coming back.
Yeah.
Yeah.
Well, yeah. Well, thank you, Janelle. I really appreciate your time today. It's been a wonderful conversation. And folks, take a look at the resources that I've got in the show notes and make sure you pay attention to what the nonprofits in your community are up to and get involved where you can. Thanks, Janelle. We'll talk soon.
Thanks, Julie.
Julie Noonan here. Thank you so much for listening to Roaming with Restless Women. If you're a successful senior woman leader who would like to be on this program, please visit podcast.intuitivewisdomcoach.com. If you enjoyed this interview, please share this episode on social media and make sure to subscribe so you don't miss any future episodes. Your thumbs ups and reviews go a long way.